So the title of this lecture was "Teeth Have Feelings Too," and these teeth of ours can show kind of quite a lot of emotions. They can show pain. They can sometimes show happiness, and that happiness is sometimes in the versions of silence. Maybe it's in the versions of being bright. It could be many things. So I'll start off with this small little video, and it kind of shows you the way that teeth develop when in the embryo stages. I'm not going to play the whole thing. I just want to play a little bit of this video so that we can kind of just get a quick idea of how your teeth develop. Yeah, thank you.
In the developing human embryo, in week 6 of gestation, the teeth will develop in a complex process that involves a myriad of different cell types and tissues. Within the developing jaws of the embryo, epithelial and ectomesenchymal cells will interact with each other to produce teeth. This animation will outline the first 3 stages of tooth development: bud, cap, and bell. Prior to the bud stage, 2 bands of thickened epithelium form in the presumptive upper and lower jaws of the embryo. On each band, a ribbon-thin shelf emerges into the underlying ectomesenchyme. This inward growth is called the dental lamina, and is the beginning of tooth development.
John, I might ask you if you can pause that video.
Bud stage commences with the formation of...
Great. Yeah, I just wanted to really just go and talk to you about the bud, cap, and bell stages of tooth development. John, I might ask you if you can just advance the slide for me. So I'm just going to quickly go through. So this is this animation is showing you those bell cap and bud stages of tooth development. All you really need to see from this is where each layer starts to make the 3 tissue layers that will the tissue layers of the developed tooth that we'll be talking about: enamel, dentin, pulp, cementum, and the outlying and the ligament that holds your tooth in your jaw. So this is what that's showing you. They have different names. They have the name of this layer is called the inner enamel epithelia. The name of this layer is the dental sac. And each of these are responsible for making a different part of your tooth. The sac is responsible for the cementum and what's called the periodontal ligament. So in very simple terms, the cementum is what surrounds the root. The periodontal ligament is that cushion between your tooth and your jawbone that gives you, that almost acts like a cushion, almost like a like a dampener. So it kind of breaks the fall. It does some other kind of anatomical things, but we'll get into that a little bit later.
I just want to let people know that using the QR codes on the bottom right of your screen with your phone, you can also interact with these 3D visuals.
Yeah, please feel free to do that and play around with the visuals. These visuals are really helpful. You can rotate them like I'm doing here, do all kinds of things. You can zoom in and out of them as well. So we're looking here at a fully developed molar tooth, and I'm going to just kind of trace out this layer here. This is a layer called enamel. Enamel is the hardest substance in your body. It's formed by one of those layers that was shown to you previously. This is what people see when they look at your tooth. They look at this, they're seeing this tissue layer. Now, believe it or not, this tissue layer is not actually what gives your tooth its color. The color of your tooth mostly is determined by this layer, and this is called the dentin. So you can think of this as the outer jacket of the tooth, and you can think of the dentin as the inner kind of lining of your tooth. This is the part of the tooth that actually shines through and gives your tooth color. It also, so the enamel does not have so much sensitivity or feeling to it. The dentin kind of does. So as you work towards the outside to the inside of the tooth, the feelings and things become much more pronounced. This layer here that I'm circling is the dental pulp. This is where the nerve and the blood supply of the tooth are. This is the part of your tooth that when you eat some cold ice cream or drink something cold or drink something hot, your tooth kind of feels it. That's the emotion it's feeling. It's coming from this layer here. Now, even though this tooth is alive, has a nerve and a blood supply, it doesn't necessarily need this in order to survive in your mouth. When this, we'll talk about this in the next slide, but when this pulp starts to become injured, this pulp sometimes can't regenerate themselves. They can't often heal themselves. Sometimes they can, sometimes they can't. And that's where we initiate treatment to actually remove the tooth, remove this pulp. We remove the pulp of the tooth to stabilize the pain or stabilize the infection in the tooth. You may have heard that term before. It's called root canal treatment. The cemental layer of the tooth is actually this point here, going all the way down around the root structure. This layer is not, even though it seems to be the same outside as your enamel, it's actually not as hard. It's a much softer material. And some people you start to see this exposed when this area here, the gums that surround your tooth, start to fall away. You might start to see this layer. It's often much darker than the tooth layer up here. It's also a layer that gets very worn away. When you take your toothbrush and you brush it and scrub it and you brush it very, very hard, very, very vigorously, you can actually wear this away, almost like scrubbing a countertop. So these are areas that we need to be careful when you have your dental visits and things, and they tell you to brush softly. This is actually what they're trying to protect. They're trying to protect this area here, because when people lose this gum tissue and expose this, it becomes very vulnerable to abrasive actions such as hard toothbrushing. As I was mentioning before, this is the gum tissue that surrounds your tooth. We call it gingiva, we call it periodontum. It has a number of different names. In between the gums and the tooth is a structure known as a ligament. Ligaments are features in your body that hold one type of body type to another body type. So a ligament may hold a bone a ligament may hold a bone to a muscle, a bone to a tooth. So it holds different kinds of body structures together. You may also have heard the word tendon. Tendons hold the same type of muscle of anatomical structures together. So muscles that attach to muscles are held together by tendons. Bones that hold teeth together, those structures that are in there are called ligaments. Okay. We're going to move over to the next slide. And here, we're going to talk about one of the most basic things that can go wrong with the tooth, and that's called a cavity. In our medical and dental terms, the term we use is called caries. Caries begins in different stages. The first stage is called enamel caries. And if you can see here, this would be where the cavity or caries would start on a tooth. It can start in the middle of the tooth where the chewing surface is. Caries can also start in between your teeth. Now, it takes quite a bit of time for this cavity to penetrate this enamel layer. That kind of time depends on what the conditions of your tooth and what the conditions of your mouth are at the time. A tooth that's newly developed, say, for example, in a 6 or 7-year-old, this enamel layer is not as strong as it would be in a 30-year-old. So when a cavity starts in a 6 or 7-year-old, it will move much faster than it would in someone who's 30 years old. When it penetrates the second tooth layer, now we call it dentin caries. As we were saying before, this area is not as strong or is not as mineralized as the surface above it. And so when cavity moves into this area, it's going to move pretty quickly. I would say probably 2 to 3 times as fast as it took for this cavity to start here and move into the first tissue layer. This is where we need to stop this cavity from going any further. If that cavity doesn't stop, and it will eventually enter the nerve of the tooth. And there are 2 outcomes for what will happen when that cavity hits the nerve of the tooth. The first is called a pulpitis. A pulpitis is an inflammation of the pulpal tissue due to the cavity that has invaded it. This stage is painful. This is where you will feel pain on your tooth. You will feel pain throughout your jaw, and it will be quite uncomfortable. If someone were to ignore that and allow this to just keep going and going and going, eventually this pulpal tissue will just die away, and that's when the pain then comes down to this portion of the tooth that I'm circling here. And this is called a periodontitis. This is where the actual ligament of your tooth is now affected. The pulp is now dead. The pain is not coming from here. The feelings of your teeth are not coming from here. They're now coming from the ligament of your tooth. This is also a very, very painful stage. This is a stage where you could end up with a swelling in your mouth, where you could end up with an infection, with pus. And this obviously needs to get treated as well. So teeth don't always, this is just one of the more well-known ways that teeth can have problems. There's another way that teeth can have problems, and that's called gum disease or periodontal disease. Why don't you sit here? We can talk. That's my son, who is very interested in teeth as well. No. Baseball. So I'm pointing here at the top left picture, and this is a picture of healthy teeth and gums. So we're looking kind of like a cross section here. I should hope so. In a normal set of healthy teeth and gums, we have a nice pink gum tissue. We have nice healthy bone and ligament levels. This tooth is free of plaque, free of any kind of tartar that's sticking to it. So let me quickly go back and explain what plaque and tartar are. Plaque and tartar are natural formations that occur in your mouth and on your teeth. But when left for long periods of time, the plaque becomes hard and becomes stuck to your tooth. And when that occurs, the term we use is called calculus. This is not too different than looking at barnacles on a ship that you'd see docked at the bay. These barnacles get stuck. They can't be removed with your toothbrush. They can't be removed with your floss. They are full of toxins, bacteria. And when we get to a stage called gingivitis, that's when we start to see changes in these gums. The gums don't look pink anymore. They look red. When you brush your teeth, when you floss your teeth, you might notice some blood. That blood is an action from your body trying to fight whatever is happening to your tooth. And that fight is called inflammation. Now here's where gum disease becomes slightly more complicated. When this gum disease advances, it's actually a battle of 2 different kinds of things that are happening in your mouth. It's the bacteria from the calculus that's causing that will be starting gum disease. But what's also projecting it, and so what's also accelerating it, is your own body's reaction to these toxins. So we call that a host response. Now that term is not used here, but that's actually what's happening when you get to this stage. This stage is where you start to see real destruction to your teeth, and this is what we want to avoid. You don't want to be in. This is not a situation you want to be in. This pocket, these gum tissues are very red, very inflamed, and you're starting to see that you're losing the bone around these teeth. Once this bone is gone, you can't bring it back. This is a different kind of management. This is a different way. This is not like This is not like getting over the flu or taking a pill and curing whatever ails you. This is something that's got to be managed now. And when it really goes bad and really goes south, it starts to look like this. And this is where people lose their teeth. Now, what's also not on this slide is what the effects of gum disease do to your body, because there are many, many things that gum disease has been linked with. There are what we call comorbidities to other systemic diseases like high blood pressure, diabetes. All of these things are major factors in how this disease plays out. So when we see people at our office and we see that a patient has high blood pressure, diabetes, other kinds of ailments, we have to see how those ailments link to what's going on with them. So we are very careful about screening for these things when we see patients in our office. We'll go over to the next slide. Something like that. We'll explain it in a minute. And this slide again here is just going to show you some different stages. I don't want to. I won't go into this too much, but this is one of our tools that we use to measure the health of gum tissues. It's called a periodontal probe. So many of you are familiar with the instrument that the dentists use to look for cavities. That's called an explorer, which sticks on your teeth. This is something that's measuring those gum pockets around your teeth. It's looking for tartar buildup. It's looking at the depth of these pockets. We have certain criteria and certain measurements that we use to see how healthy someone's gums are. And this is the number one tool that we use right here. So this stage here is called periodontitis stage 1. Basically what this is saying is that this gum tissue is measuring a little higher than normal. There's nothing, the teeth aren't loose. We're not seeing major signs of things, but it is kind of moving in a way that could mean that it's advancing. Let's quickly go to number 2. This is the effect of the teeth on the gums. You can see here in this diagram, gums are starting to move away from your teeth. And this is one of the effects of gum disease. This is showing you what we use in our office to monitor also for gum disease, cavities, and dental health. These x-rays show us where those areas are. On an x-ray, we can see bone levels, such as this. This is showing you a stage 2, where the where the depth of that pocket is going even higher. We'll quickly move to an effect on these gums. Seeing what's called gum tissue loss. Tissue recession is another word for it. And again, showing you that x-ray. This is where the gum disease really becomes quite severe. Starting to see these pockets at a depth which is very uncontrollable without proper intervention. These teeth start to move. They may be infected. Many things can be happening with this. And what's also problematic with this is that these aren't necessarily painful things that happen. And that's one of the things that we really want to emphasize to people. Just because something doesn't hurt, it doesn't mean something isn't wrong.